Welcome back for 5 Minute Friday. I am your host, Dr. Elliott Cleveland, and I'm super excited to give you guys information as you head into your weekend. And this information comes straight from the questions that you sent me this past week. So here we go. We got 5 minutes to knock out as many questions as possible. Question number 1. Is Pitt as hard as the actual band? So, is being in the front ensemble as difficult as being a band member? Yes, do not let someone underestimate how hard you're working just because you're not one of the ones running around on the field. Pitt has to do way more unloading and loading of their instruments on a regular basis. So, while the band is out there starting basics block, Pitt's just trying to lift their instruments and get them out to the field. I'm going to do a segment coming up soon about how Pitt needs to be lifting weights and doing a lot of working out in addition to what the band is already doing. So don't let them down on you just because you're in the pit. Next, do you have intense shoulder pain from marching and how do you fix it? I am going to put out a segment real quick that we kind of teased at earlier about using a lacrosse ball, so a massage ball, to rub out all these knots you get in your shoulders from marching. So if you're holding a horn up, you're putting tension in these muscles here. If you're carrying a drum, that carrier sits in your shoulders and really causes those muscles to knot up on you. We need to use something like a massage tool, a massage ball, to help relax these shoulders and get those knots out for you. Do I have any tips for stretches and warm-ups for drum majors? Yes, I do. Don't overthink it. Drum majors, you guys are using your arms and you're using your shoulders heavily while you conduct. The one thing I want to teach you guys is to make sure it's not coming from here. So as you conduct, you shouldn't be shrugging up your shoulders with every move that you're making. If you're going to do that, then that is going to cause a lot of excess tension going on here, which is going to feed back to that previous question on shoulder pain. I've had to work with a lot of drum majors over the years to correct their technique and take pressure out of this part of their neck and shoulders. For just warm-ups and stretches, you can stick with basic arm circles. Just going up and down, you can go with big circles, then you can try some small circles to get some of those more controlled movements. I recommend going forwards and backwards so that you get both sides of your rotator cuff and your upper body muscles. You can also do what are called pat on the backs or arm swings. For just warm-ups and stretches, you can stick with basic arm circles. Just going up and down, you can go with big circles, then you can try some small circles to get some of those more controlled movements. I recommend going forwards and backwards so that you get both sides of your rotator cuff and your upper body muscles. You can also do what are called pat on the backs or arm swings, just back and forth like this. This will really help loosen you up. If you have that tension in your shoulders, whether it's from marching or conducting, try an upper trap stretch. So the upper traps are these muscles right here. Just try to tilt your head like this until you'll feel it pull in these muscles. Do 30-second holds on each side. So 3 rounds of 30-second holds on each side here to help loosen up these neck muscles. I recommend doing dynamic stretching before your conducting begins. So going through the arm circles and the swings prior to rehearsal, and then after rehearsal, if you're starting to get a little sore, go through the stretches up here. Next, do I have any advice for going to physical therapy school? Some of you have been looking into this, which is awesome. We need more physical therapists out there, especially in the marching arts. Yes, I was a tour guide and knew all of the admission statistics while I was in PT school. You really need to focus on GPA, then getting observational hours in a clinic and developing your leadership skills. So they don't want somebody that's just a 4.0 student. They want a very well-rounded individual. Continue on with band if you're in band. Get in a leadership position so that you can learn how to serve others best. Healthcare is a service field. You want to apply those skills that you learn in band to how you treat people as a practicing physical therapist. GPA-wise, when you get to college, you need to keep your GPA typically above a 3.5. So as many or more A's than B's as you go along. And you're going to have to take special prerequisite courses in that process. And then Get observational hours. Go out, find a couple of physical therapists in the community, shadow them, see what they do, and understand what this is really about. So there is your 5-minute Friday session with me. Send me your questions next week. Use the hashtag 5-Minute Friday. Send them on Twitter, send them on Instagram, or Facebook message them to us. We will see you next Friday. Thank you.